Hi, this is Junaid. I'm one of the Neurocritical care and epilepsy specialists. And today we're going to talk about my favorite topic, which is why neurology is so important. It's a little self-serving given that I'm a neurologist, but we all have to understand that we all have to age gracefully. And this is the key issue, aging population. If you look at it, the data, we have significantly improved our lifespan. In the last century, our average lifespan was 30 years. Now we live up to be 83 years on an average, longer and potentially even longer given the breakthroughs of technology we are looking at. According to the United Nations, we are looking at 2.1 billion people by 2050 who are above the age of 60. And that's significant. That's 1 in 4 that is going to be above the age of 60. And this comes with a significant multiple morbidities. Anyone who's above the age of 60 is living with multiple morbidities. The most common of them is cardiovascular disorders, in which the stroke is a subset, and then malignant neoplasms, chronic respiratory distress, etc. In neurology, what we see is a significant curve of different disease burden at different age brackets. When you are a child or an infant, we're looking at encephalitis and meningitis. As you grow older, the key issues become migraine, multiple sclerosis, headaches. And as we grow even older, stroke and Alzheimer's take over. And that makes people live with significant disability. That is huge. We need to take care of our aging population, especially the neurological disorder, because it's debilitating, it's disabling, and in some instances, people are unable to live with dignity. So we definitely need more neurologists. Unfortunately, we're going to have significant lack of neurologists as compared to what we need. As a matter of fact, by 2025, we're going to have 19% shortfall. That's literally 4 years from now. 19% of shortfall in having neurologists. And that's only going to increase. And this is not the whole story. The bigger issue is that if you see the red area, that's all rural areas. And the areas in which we need the most amount of care is going to lack the care. I mean, there's going to be a lack everywhere except for a very small corridor in the northeastern region. But other than that, you're going to see significant lack of neurologists, and there will be a significant mismatch between demand and supply. So if rural areas are the most affected and there's going to be significant lack of neurologists in those areas, how do we provide neurological care in those affected areas? There's only one solution, and that is teleneurology. You virtually care for these patients, and the neurologist is beamed in there so that they can help those patients appropriately. The lack of neurologists signifies the importance of virtual care. We need to augment the presence of neurologists and expand on them. We need to make them virtual so they don't have to travel. Even me as a person living in Dallas, Texas, if I'm hopping from one hospital to another, that takes away my driving time. That takes away my parking time. It's ridiculous that we are still trying to fight this idea that in-person care is better than virtual care. It is same. And I'm not saying that it's every time you have to do it, but at least initial evaluations, at least times where a neurologist can see the patient and advise if they really need to travel. Because again, as I said, these are disabled patients, debilitated patients. We need to make sure that if they're going through an ordeal of traveling 1 to 2 hours, it is worth their time. And with the advancement of technology, we will be able to bring stuff like labs and x-rays and even portable MRIs nowadays to different rural populations. So we need to remove barriers, especially traveling, and make virtual care, especially teleneurology, universal. Most importantly, if I am one of the big issues, and I've seen that physician burnout, especially in general and in neurology, is the stupid documentation burden. Interestingly, the virtual care is time-based, and therefore you're reimbursed not because of your documentation, but actually because of your time spent with the patient, which is amazing. And therefore, virtual care should be universal. And I love that, the fact that I have to decrease the burden of documentation, document what is actually more important, which is care of the patient, the care plan of the patient, rather than copy-pasting labs and stuff from the EMR. And in places where there is going to be a significant need and a volume that needs to be taken care of, we should add physician extenders like nurse practitioners and physician assistants. So what telehealth companies need to do to achieve teleneurology success? And it is divided into two different areas, in acute care setting and in chronic care setting, because those are two different areas in which neurological patients are there. In acute care settings, what you're looking for is concentrate on the systems of care, because you're taking care of stroke patients, neuro ICU patients, or inpatient neurology consults. In that setting, what you really need to do is basically understand how the systems of care is going to be evaluated, not just the physician. You have to really concentrate on the 3 C's: collaboration, communication, and teamwork. Now, when their stroke is initiated, let's say Telestroke, it could be in a primary stroke center, which needs to be transferred to a comprehensive stroke center through thrombectomy. So what we need to concentrate in a secure messaging platform or remote teleradiology, viewability of EMR through different platforms so that we can provide those cares. And there will be protocols and systems built where teleneurology is part of the team. And that's where VeeMed comes in, because we actually help healthcare systems to provide a solution, not just a platform. In chronic care settings, multi-party view is extremely important because, as I said, patients have stroke, cognitive decline, Alzheimer's patients. In these situations, we need more information, and that information may not be with the patient itself. It would be probably with the daughter, the son, the granddaughter, anyone, and we should actually be able to access them, call them directly through the multi-party system, which is part of the VeeMed OS, that we can call those people right up and get more information to help the patient appropriately. We need to make sure it's completely, extremely ease of use. It should be one-click initiation of the telehealth visit. As I said, again, it has to be very easy for our elderly people to get on board and get the help they need. And then there should be a way of reminder system, that easy reminders in a way that these patients understand that they have a telehealth visit and therefore they're prepared for it. There should be either SMS, text, or email, and all these features we have built in the VeeMed system. And more importantly, we should be able to have an education platform like this so that people, not just patients, are prepared for it, but their family members are prepared for it. And post-visit education should be a big part of the platform itself. So the systems must be robust. It should be hardy, because the problem really is, again, there are tremors and they can hold those tablets or stuff and they can fall, etc. So it has to be a robust system. It needs to be reliable. You cannot. I've had this problem with different patients. I mean, they've sometimes just, cancel by mistake and they don't know really how to reinitiate it. And it has to be very rapid. Again, we always concentrate on how YouTube and Twitter and LinkedIn and everything is doing robust, reliable systems. We need to be better, if not the same. Excellent PTZ camera, especially in the acute care setting, because we need to do pupillary exams, we need to do gait exams, and we need to zoom out and see if the patient is walking in a way or not. And then we are doing tremor exams. So the quality of the system and the camera becomes extremely important in teleneurology settings. And then the UI should be better for the patient, it should be good for the physicians as well. It should be an excellent UI system. It would have significant speed and it works beautifully in any operating system. So these are all the features that we have built in VeeMed as well. This is basically an all-in-one care platform, and the idea behind is that we have all the features in a specific need scenario so that you're not overpaying for your needs. So what we have as services is considered as platform, which includes inpatient, outpatient, and remote patient monitoring. Solution building, as I just suggested, that systems of care approach for ICUs, stroke care, etc. And then physician services as well. If you need a teleneurologist, telepsychiatrist, teleneurosurgeon, telehospitalist, or tele-ICU physician. I'm very grateful to be part of this excellent team at VeeMed.